Today we're going to talk about another use of Botox, which is Botox for pain or chronic pain. That's not really my specialty. I'm really focused on cosmetic uses of Botox, so I probably could talk to you for hours about the cosmetic indications for Botox. I don't do it for muscle dysfunctions or other things like that. But in the head and neck region, I do use it on occasion for discomfort or pain. I wanted to tell you about my experience with it and some of the success stories that I've found using Botox for either acute or chronic pain. The one that people probably know a lot about is Botox for migraines. And I have done a decent number of patients who have just come in for really cosmetic indications. And I've treated their headaches, I've treated their cosmetic indications, and their headaches have been markedly diminished. I have a lady from Houston that comes in about every 3 months or so for Botox, and I was telling her, your wrinkles look great. I don't have to do this at 3 months. Let's go ahead and stretch to a 4-month interval. And after a couple rounds, she said, Dr. Lamb, my headaches are so much better if we do a 3-month interval. And I said, well, I wish you had told me that. I was only pushing you to a 4-month interval because I didn't think your wrinkles were that bad. But you can obviously see that Botox in general lasts about 90 days. And so she really needed it to maintain her, to minimize her headaches. I've had another couple stories of trigger point areas that sort of inflame and create migraines. For example, sometimes it may be related to either a nerve or a muscle ache, some point of the head. And Stephanie, who's filming this for me, she had a lot of migraines. She told me about even twice a month, which were debilitating. And since October, she really hasn't had any migraines at all since that time. And all I did was I did two rounds for her. And what she had were a couple points that she could actually localize with her finger. And really, to me, it's so exciting that I can actually do a couple small doses on a couple targeted areas and get someone hopefully relatively permanently free from pain. I think part of the reason for that is that it breaks a pain cycle. And when you're in this sort of chronic mode of pain cycle, it really creates this sort of ongoing spiral downward. And if I can sort of release that pain cycle, it can go upwards. I've had a couple patients too that had some discomfort after a facelift, where there's a little bit of a nerve irritation right here called the great auricular nerve. And one lady I was working with had quite a bit of discomfort actually in this area, which is pretty rare, but I had a couple of patients, and I tried Marcaine, I tried lidocaine, things like that tried to alleviate the discomfort. Couldn't get it. I was very frustrated, and it took me about 2 days. I said, I'm going to try some Botox, and I put Botox in for her, and it literally completely went away in a very short time, within even a day or so. What's interesting with this is a lot of times when we deal with Botox, we always think it's going to take about 3 days to 14 days for the onset to occur, and that's usually the case. I think with pain discomfort zones, that can be the case. It can take 3 days to 2 weeks. Oftentimes, somehow the Botox works even more quickly in these pain receptors or pain nerve fibers, and I've seen relief even within 24 hours. And so to me, that's really exciting. When I work with hair restoration, I do really careful tumescence, which means I put fluid in the back to lift the follicles 50 miles away from the nerve and blood supply, so that I've never had any chronic pain from closing this incision line. And even when I close my suture, it's always at the mid-follicle level, so it doesn't go deep and ensnare a nerve. Other places, to be honest with you, are very rapid in the way they do hair restoration. It's a slam-bam job, get you in and out by noon. They don't really care about protecting a lot of the nerve and blood supply, to be honest with you. And I've seen a decent number of chronic pain patients coming through here, usually in the occipital region right back here. And I've worked with them on Botox with significant improvements. And sometimes not complete resolution, but to the point of being very uncomfortable and debilitating to very mild and irritating. And that to me is really exciting. So, I don't have a million examples of treating pain with Botox. I just think it's a fabulous product. I don't own any stock in the company. Obviously, I make money by doing the procedure here, but I don't own any stock, and I don't take money from Allergan directly. In fact, just to let you know, I was at the National Educational Faculty meeting last year. All of the money that was given to me, I actually passed on to charity. So I don't want you to think that I have any kind of conflict of interest of describing Botox. I just think it's a wonderful product in terms of what it can do for you outside of just some of the cosmetic indications.